Hello everybody, I'm Dr. Shiau from Clear SK. Today I'm going to share with us about injections for the face. A lot of people are concerned about the kind of injection they should take, whether they should have manual injection right onto the skin or whether they should opt for injector guns, which is a more high-tech way of injection. So which is better? I'm going to share today what are the differences between the two and which one you should choose. So for manual injection, we actually apply a very fine needle to the tip of the tube like that. So the syringe look like that, okay? And then for wrestling the tail, it actually has a built-in valve like that. So we can adjust the dose injected. So you hear this. You can see every time we inject, there's one little drop coming out. So there'll be a click and a click. Okay, so this will help the doctor to adjust the dosage, and it's manually injected into the skin about 1 cm apart. So of course, this will depend very much on the skills of the doctor. Next, I'll be talking about the injector gun and how it works. So the injector gun looks very much like this. You can see there's a computer screen. And this particular gun is we call the high end of the Rolls Royce of injector gun. Reason being, it's very expensive. It costs about $10,000. And you can adjust a lot of things like the exact dosage used, the depth of the needle, as well as the suction mode. So it's very important that the gun has this ability to adjust and how fine is each adjustment. So it looks like this. So this is what we call the injector gun. We have this sterile needle tip which is disposed of after every use. So each tip is for one single patient. It cannot be reused. So when we remove it, it looks something like that. Okay. And when we start, we will turn on the button here. And we will set the depth that we want to do. So different depth is used for different conditions. Like a deeper depth is used for scarring. A superficial depth is used for just hydration alone. Alright. So when we are ready, we will apply this onto the skin. You will actually suck the skin, and then when we press, you can see the gun will actually push forward the ingredients of the syringe. So the ingredients of the syringe will move out through the needle. So this is what we call by an injector gun. So let's compare the two between manual injection as well as injector gun injection. In terms of cost, manual injection of course is already charged into the treatment. It is a manual skill of the doctor, and each injection is done by needle into the skin. So if you opt for the injector gun, you have to pay for the injector tip, which is that special needle as shown. There's actually 9 needles built in. And these needles are actually disposable. Every use will throw it away. It will not be recycled and used again. The treatment time is very much shortened compared the manual to the injector gun. Typically, manual injection of the face will take about 10 to 15 minutes, and typically each side of the face get about 20 to 30 injections. Using the gun, the process is over in less than 5 minutes. So manual injection generally has a longer downtime because it's humanly impossible to inject anything less deep than 1 millimeter deep. And once at 1 millimeter, we can hit the vascular level where there are many small tiny veins, and therefore the chances of bruising are really there, and it's more painful. The downtime for injector gun is comparatively much shorter because we can technically control the exact depth of every single injection, like just like I've shown here. So usually, depending on the reason for the injection, let's say you're doing hydration, anti-aging, I can keep it to 0.2 to 0.4 millimeter for this particular machine. So at this depth, there's very little microcirculation or microcapillaries present, and there's minimal to no bruise at all. But of course, if I'm planning to do this for acne scarring, then I can go about 1 to 2 mm deep as well, and that will cause bruising. So it is very controllable if you have the injector gun. As for consistency of injections, manual injection tends to be less consistent compared to injector gun. Reason being is really very dependent on the hand skill of the doctor. Every point of injection must be consistent at about 1 to 1.5 cm apart. The depth must be consistent, and sometimes the hand cannot control if the skin happens to be very thin, very fragile, and can just go a bit deeper than expected. Whereas for the injector gun, all these are preset by the machine and it's completely automated. So therefore, the control is far better. Injections are consistent. Every point you get the same amount and the same depth. The final results are actually very similar. It's just that sometimes the doctor can combine manual with injector gun injection. Let's say certain areas has a huge depression or sunkenness, and the doctor would like to have better results. In this case, we will actually do a manual injection just at a particular 1 to 2 cm square of the skin to get better results at that point. A lot of people like to ask me about wastage. They say that, oh, I heard that manual injection has less wastage, injector gun has more wastage. So I would say that maybe a few years ago, this is completely true. Because at the time, most of the injector gun, as the injection is happening in the gun, a lot of the liquid will flow out at the injection points. But now with the new generation of injector gun, you'll notice that there's very good suction at every point of injection, meaning that the skin is adhered tightly to the needle and there's no place to leak. So generally speaking, the leakage is very, very little, less than 5%. And with the exact amount that can be adjusted, one single cc can be injected over 50 points of the skin. Whereas 1 cc manually, we probably can do only about maybe 20 points. So there might be a little bit of wastage because maybe we can't cover the entire face, just the cheeks if we use the manual injection. So what are the benefits and the limitations? So for manual, I will feel that it's very much dependent on the injector's hand skills. So the doctor must be very familiar with injection and very able to control the fingers very well. And she must understand the skin type of the patient very well so as to make sure that the point of injections are well delivered. Whereas for the injector gun, everything is completely automated with a good quality gun. The control is excellent. The dosage, the depth is completely within control. Some of the areas that we would like to combine treatments will be such as like the angle of the mouth, the area near the eyes. Sometimes we will do a bit of manual injection in combination with injector gun. I hope this answers your questions. Thank you.